Morning once again. Now, South Africa has recorded 97,302 confirmed COVID-19 cases to date. The death toll from the virus is creeping closer to 2,000. Infections continue to grow in Gauteng. The province now has the second highest number of infections in the country. Meanwhile, the Western Cape still remains the epicenter of this virus. Let's carry on our chat as we do daily with Adrian Purin from the National Institute for Communicable Diseases. Adrian, good morning. Let's once again just look at what we're seeing, especially now with us being, I suppose, safely in the thick of winter, or not so safely, if we were to put it that way. What are we seeing in terms of the epi curve? What story is it telling us, and especially about certain provinces? A very interesting graph that we're looking at the moment.
Yeah, so you can see the unfolding story, and it was predicted that it started off in the Western Cape, but now we can see other provinces being affected, and it's clear now as you look from the tip of the columns, and you can see that is, for example, the Eastern Cape, for example, is in the orange pink, and then you can see a bit of a blue, and that is KwaZulu-Natal. Then you have the green, which is the Western Cape, and now you can see the Gauteng growing exponentially as well over this particular period. So those are the key provinces that we need to now focus on in terms of the epidemic.
So what do we do when we say we need to focus on them? What needs to be done for these provinces at this point?
Yep, so I think it comes back to all our messages. So at the individual or personal level, again, it really is about the physical distancing, washing of hands, the cleaning of surfaces. The physical distancing is really a key and important point that we really need to emphasize. And again, it's keeping to one's social or physical bubbles. Those are the safe bubbles. Don't try and merge those bubbles. Keep them separate. Don't try and join larger crowds or groups, for example. Really keep those safe distances at an individual level. And obviously at a provincial level or sub-district level, it's also key to make sure that the tracing, isolation, quarantining, all these activities now really continue, as well as the testing at those vulnerable areas. For example, the healthcare workers, the vulnerable homes that we have, the hospitals, the clusters or outbreaks. That's where we need to be focusing on and tracing, isolating, in order to really limit transmission of this virus.
And especially with the easing now of even further restrictions when it comes to lockdown level 3. And I think we are going to see significant changes, don't you think?
Absolutely, and as people come closer and closer together, that's where we're going to have transmission. So the wearing of masks, again, I need to emphasize, it's not only for me, it's for you that I'm wearing this mask. And so those are the important things, especially if you're going to be in hairdressers, if restaurants are starting to open. Closer and closer contact, higher and higher risks are going to evolve. And so it's really critical to see that. I think the other emphasis point that I want to raise, it's not on that graph, but we're starting to see excess mortality, not in South Africa as a whole, but for example in the Western Cape and Cape Town specifically, we are seeing more people dying of natural causes. It's likely that the likely cause of those particular deaths is a result of COVID infections.
And just to go back to that graph that we were looking at, Adrian, and just to look at the epi curve there, I mean, we're all waiting for the flattening of that curve, and I think just to look at there, it seems, well, to my ordinary eye, not a medical person or scientist, like we're very, very far from any flattening of this curve, especially if we look at the Western Cape in particular, where they're expecting to peak sometime this week as well.
Yeah, I think it's still a way off. I think it's still a few weeks to go. So, yeah, I think we still need to be patient, and therefore this emphasis around our public service announcements is really key. I think people really need to take it seriously. I think my sense is you're quite right. I think people are going through this lockdown thinking it's all over. It's not all over. We're here for a few months still to go.
And I think, many people wondering, we've seen government relax these. Are we just going to see the next time we hear from the president saying lockdown is over, we're not even bothering to go to level 1? And you're right, I think the perception out there is that the more we ease things, the more people think it's actually okay now. I'm not sure that they are interpreting correctly what is actually going on outside there and what's expected of them.
Yeah. In fact, we're also not even talking about other provinces where, for example, testing may be at low levels, for example, so things may be missed there as well. So I think we really need to be cautious and concerned and do the right things.
All right, we'll leave it there for now. Thanks very much there, Adrian Purin from the NICD. Just this graph and showing us in Gauteng again on the up there. It's not looking good at the moment.